morning. Today we are with Liz Murray. Liz is currently a visiting associate professor with the Department of Nursing Education. Liz Murray is currently a visiting associate professor in the Department of Nursing Education, University of Witwatersrand, and a part-time lecturer at Netcare Education. She studied at the University of Free State and obtained a clinical master's in advanced general nursing and a doctor's degree from the University of Pretoria in the field of oncology nursing. Liz has taught and mentored oncology nursing scholars on all levels in various African countries as International Atomic Energy Agency expert. She assisted with the development of a number of oncology and palliative nursing curricula in Africa and served on the palliative care educational and training task team appointed by the Minister of Health in 2016. She is currently serving as a board member for the Sun Gardens Hospice in Pretoria. Good morning, Liz.
Good morning. Good morning.
Today we are going to be talking about palliative care, which I believe is a topic that is close to your heart. I think my first question is, what makes palliative care unique? What palliative care in nursing unique?
Rita Billy, palliative care cuts across all disciplines. Palliative care nurses or people with palliative care education and training can work or practice in all settings. Palliative care is an integral part of oncology nursing or cancer nursing, but patients who are in ICUs, even those in the primary health clinics, also need palliative care if they are diagnosed with an end-of-life disease. So a nurse with palliative care education and training can practice across all the fields of nursing. Also nephrology nursing, cardiac nursing, even in the theater, because we need to be a spokesperson for the patient. And I always wonder who speaks for the patient. If a patient needs to have an operation, that might not have a very good outcome.
Thank you very much for that, Liz. I mean, I'm always confused between palliative care and supportive care. So can you just tell me what the difference is between the two?
There isn't really a difference between supportive and palliative care. You know, supportive care is actually the care that we give to cancer patients, but it also includes palliative care. Palliative care started in the UK, whilst, and you will see, it depends on where you live in the world, whether you are a supporter of supportive or palliative care. So it's the same thing, it's just two different words that we use. For instance, supportive care is very strong in the US, but that is the same as palliative care, but that's the word that they prefer. Whilst in the UK and specifically in Africa, we support the term palliative care. And it starts at the same time. It starts once a patient has been diagnosed with an end-of-life disease, and it continues through the trajectory of the disease, and even afterwards, when the patient have died, to support the family after the death of the patient. So it doesn't matter what you call it, as long as you do it.
That's actually very interesting and very informative, because I think for some of us, the minute you start thinking of palliative care, considering that there are no other options, you are almost at the end of your life, it's a bit of a touching subject, which is very difficult for some of us to understand. But within the clinical practice, what are some of the challenges that are there for palliative nursing that that most nurses are facing?
You know, Rita Billy, you actually said a very important thing, and that is that palliative care is sort of connected with there's nothing that can be done anymore. And I hear that so many times. And especially if you think in terms of cancer care, you might not be able to receive palliative treatment or anti-cancer treatment, but there's always something that can be done for you in terms of symptom management and to prevent you from suffering. So many people associate palliative care with terminal care or end of life care, and it isn't that. It starts with the diagnosis. And I think that is how many nurses see that. And when a person is diagnosed with an end of life disease, because many nurses don't really have knowledge of palliative care, the patients suffer because we do not advocate for them. Sometimes we allow patients and family members to make maybe not such wise decisions. Because remember now, as a nurse, we were taught to save lives. And we have to save lives. We must save the lives of people whose lives can be saved and who would have a good quality of life thereafter. But we must also allow patients whose lives we cannot save to have a good death. So I think the fact that many of us don't have knowledge about palliative care do not allow us to advocate for the patients and the families. And what we do atrociously is we really do not assess pain and other symptoms. And if we don't assess it, it is not addressed. And I always say, and if it's not measured, it's not managed. So I think a lack of knowledge is our greatest challenge in palliative care. But of course, with the new curriculum, palliative care is in the new curriculum. And it is part of the undergraduate education and training of nurses in the new curriculum.
It's actually interesting that you are mentioning that it is part of the new curriculum in the undergraduate training of nurses, because I think my next question would be, is it registered with the Nursing Council? Because I think it's one of those, as nurses out there, they want to know that whatever they are studying bears credit for them or is registered with the council that they affiliate with.
Yes, you know, that's also maybe something that is very, very sad, that nurses want a bar for everything. And palliative nursing is part and parcel of the oncology nursing program in South Africa. Now, you know, we've been debating this for donkey's years. Where must palliative care fit in? But because palliative care now weighs a certain amount of credits in the undergraduate program, I'm not speaking on behalf of the Nursing Council, but that is what I understood. There was not sufficient credits to make this a separate course. And being part and parcel of cancer nursing, oncology nursing, cancer care, it is included. It forms part of the oncology nursing program now. So if you have done the oncology nursing program, you will be registered as an oncology and palliative nurse. Now, I know many people say, yes, but it's not the same thing. You know, we learn and we teach principles. when we teach specialist nursing programs. So the principle for pain management, whether you are an oncology nurse or whether you are in the ICU, is exactly the same thing. So maybe it's not the ideal, but at this stage, it is the best that we can do.
Thank you very much for that. And I mean, at the end of the day, what we have just discussed in the last couple of minutes is the importance, and you have enlightened us in terms of what palliative care is and given us a bit more detail and information. But I always say, what is the take-home message? To anybody that is listening to us out there, what would be your take-home message to them on palliative care in nursing?
Okay, Rita Bile, patients suffer severely. Patients who need palliative care at this stage suffers severely. And we are the primary caregivers of patients. And we need to advocate for them, and we need to be able to care for them so that they can die a good death.
A bit of a heavy one that we're discussing today. I think it's always not a good thing for us to be discussing death. I think all of us are afraid of death, but it sheds a bit of light to know that when we talk palliative care, we are actually looking at making the end process of your life a bit easier, managing the signs and symptoms and trying to make you as comfortable as possible towards the end of your journey on this earth. And on that note, thank you very much, Liz, for such an informative session. Much appreciated from my side, and enjoy the rest of your day.
Thank you, Rita Bile. You too. Goodbye.
Thank you. Bye.